Good morning and welcome to the Comprehensive Evaluation for Children in West Virginia who are deaf, hard of hearing webinar. We realize that this is a really tough time of year to be viewing webinars, so we really appreciate you taking the time and making the effort to be with us today. We just felt like this information was so important. We wanted to be able to share it with you so you'll be prepared for the fall. And my partner, Marianne Clendenin, the Low Incidence Coordinator for the West Virginia Department of Education, West Virginia Department of Education, and I are very happy to have you with us today. One of the things that Marianne and I wanted to do was to be sure and model what we would like for you guys to do, and that is work together. SLPs and DHH teachers need to work together to do these evaluations. And, we realized that in the past there has been a lot of joint training. We do training for this. We will always try to have both disciplines with us because it's the responsibility of both disciplines to keep this evaluation together. I'm going to go ahead and introduce two of our presenters, and then I'll turn it over to Mary Ann, and she can welcome you as well. I'd like to introduce Karen Haynes. She is a former professor from WVU, and many of you have had her in class, I'm sure, or know of her and seen her in other trainings. She's been in the field for several years and has just retired. This is her first year of retirement, so we're very happy to have her with us here today. And we also have Gail Nelden. Gail also retired, but I think it was 2 years ago. And we're very happy to have her with us too. She used to teach audiology, and she's an audiologist at WVU. And, we really felt like it was important to have an SLP, an audiologist, and a teacher of the deaf, hard of hearing to work together to do this presentation. So, Mary Ann, would you like to introduce Nora?
Yes, thank you, Leanne. Today, Nora Stevenson will be presenting in collaboration, and she is not only a DHH teacher, but she is a current West Virginia School for the Deaf and the Blind outreach specialist. She is an adjunct professor for the Marshall University program for deaf and hard of hearing. And she is a wealth of knowledge, and she has been working collaboratively with this team, and we are just very happy that she has taken on this project, and she will be presenting today. So thank you all for being here, and it's going to be a really great training.
And one of the things I like to point out too before they get started is I have heard from all three of them, and we have the dream team here as far as doing this presentation, but I've heard from all three of them how much they've learned from each other during this process. So, I hope that you guys will pick up on that too and realize that this is a collaborative effort as well. I would like to mention the ASHA CEUs. You will receive ASHA CEUs for this training. We no longer use Scantrons, so I will post a survey at the end of the training in the chat box, and you'll just have to access it and complete the survey to receive your ASHA CEUs. You'll also receive a certificate of participation that will be emailed to you probably within the week, and you can use that for professional development and that kind of thing. So without further ado, we will turn it over to our dream team.
Good morning. I'm going to turn my camera off. I'm Nora. The first thing that I want to talk about is we have all, you just heard everyone talking about the collaboration that we've all had during this training. Some of you all may have joined us back last year. I can't really tell you what month that was because during COVID it all kind of ran together. But we did a basic overview of the comprehensive language evaluation. And since then we've been working together on a document. And the one thing that I would like to say is that I definitely have learned so much from working with this team. But as a deaf educator, what I would encourage all of my fellow deaf educators that are on this session today would be for you to pay close attention to the terminology. We know that often our disciplines cross over. We all we delve in somewhat into each other's areas. What I really wasn't aware of is that oftentimes we may have been talking about the same thing, but because we were using different terminology, we didn't always realize we were discussing the same thing when it came to assessments or evaluations when we were looking at our deaf and hard of hearing children. The other thing is that as we go through this today, I would imagine that most of you all have worked at some point with a child who is deaf and hard of hearing. And so maybe think about that child as we go through this. Think about one specific child, and if you were to look at the big scope that we're looking at today, would you be able to find something differently, and how would you do that? So if you'll just keep those in mind. We're going to go over a little bit about the why we're doing this. I believe that it was in 2017 that it was written into policy 2419 that if a student who is deaf and hard of hearing does not demonstrate progress in expressive and receptive language skills as measured through an appropriate assessment tool, the IEP team must explain the reasons for lack of progress in meeting the language milestones or progressing towards them, and recommend specific strategies, services, and programs that will track the child's success towards English literacy. And therefore, it was also added into 2419 that for a child who is deaf or hard of hearing, a comprehensive language assessment in the child's language and communication mode must be included in his or her comprehensive evaluation. So this is the premise for this entire thing. So for a few years, the deaf educators, we knew that this stated in 2419 that a comprehensive language assessment was required, but weren't exactly sure what does that mean. And who's responsible? How do we do it? What would that look like for our children that makes it different for all of the other populations? So those are some of the things that we're going to talk about today. So this is just a summary of some things. The following is intended as a resource guide just for our deaf and hard of hearing students. Also keep in mind, we often think about using evaluations and assessments to determine eligibility. Yes, this is a tool for that, but we really want it to be a language evaluation that's going to show us what the academic and non-academic needs are for our students. Where are those holes? Where are the critical areas that they need supports? And we also know that when we evaluate and determine eligibility for a child who has a hearing loss, that there are many areas that need to be evaluated. We have social emotional skills. We have so many different areas. But for this session, we're only looking at language. But when you do have this document or you go through this webinar, just take into consideration that there are other areas that must be evaluated for a child besides just the language component. But for this purpose, it will just be the language. And also that few language evaluations are normed for deaf and hard of hearing population. Therefore, that we cannot emphasize enough that a collaborative team approach is necessary when choosing and analyzing the results. Okay, Karen, you want to jump in?
Sure. And as Nora said, really everything that we're talking about today, all of the content was designed together. We've worked together in many sessions since we did the last presentation. And as Nora said, we've really learned a lot from each other. And so while only one of us can talk at a time at various points today, even though one of us may be talking, another one's going to hop in. So we want you to know that this was very much a collaborative effort. So we're going to talk about what a comprehensive language evaluation is and why it's necessary. Nora started that conversation already. Who's responsible for it? How do you do it? Once you've done it, how do you analyze it? And then what do you do with those results? So that's an outline of what we're going to be covering. Nora, can you move the slides ahead? Thank you. All right, so we're going to start with what is a comprehensive evaluation. So we've all done assessments, but we tend to do assessments within our discipline. So when we're talking about a comprehensive evaluation for a child who's deaf and hard of hearing, we're really talking about that collaborative effort beginning at the level of what are our concerns and what are we going to assess. So this is rather than each discipline saying, well, I have this concern and I'm going to assess this. This is the idea here really is that the team would sit down and have this conversation about what needs to be assessed before the assessment begins, before that process begins. And so we might need it to develop specific academic goals because we're concerned about whether or not a child is making the progress that is necessary. We might be doing it to qualify them for services. But we want to be very careful when we talk about doing assessment of language that we're assessing all aspects of language. And we're going to talk about that in a lot of depth today. It's really much more than just a snapshot of where they are, but an in-depth look at all of the various aspects of their language. So it's much more than perhaps just a global assessment and looking at the audiogram. We also have to make sure that we take a look at that we understand the child's individual learning styles, cognitive abilities, and then that preferred mode of communication. We always need to know what the family has decided in terms of the mode of communication that's going to be used, whether that is ASL, whether that is English, whether that is, or spoken English, or whether that is some combination of various modes. And of course, we need to consider the child's cultural background, including, of course, deaf culture, as well as any other cultural aspects. Next slide, please. So what's the purpose? Already talked about that a little bit. It might be to determine eligibility. It might be to really develop an educational program, or it could be to determine the appropriate supports. Do we need an assistive listening device? Do we need an interpreter, an intervener for our child who is deaf and blind? Do we need an AAC system? And then it could be, we may be looking to design appropriate intervention. The team may have concerns about a child's speech and language skills, their communication skills, and they may need to develop that intervention plan. And then also to evaluate the effectiveness of the educational program in facilitating the child's progress. In other words, is there some other way that we need to be providing education to this child in order to make sure that they are making the progress that is needed? Next slide.
So here's the part where we always run into the question of who does what assessments. And we will get into that a little deeper in just a little while. But the first thing that I imagine is coming to most of your all's minds, especially the SLPs who have very large caseloads, is thinking about how in the world am I going to do all of this for these children? So I think the first thing to remember is that this is a low incidence population, so you likely will only maybe have 1 or 2 a year. Now, if you are in a residential school, or if you are in an area, maybe you are the SLP that services all of the children with a hearing loss, it may be a little different. But because it is a collaboration, it takes some of the pressure off. Primarily, when we send out those papers for permission to evaluate, normally if you check communication, that's everything on the SLP is going to do that. And then if you check audiological, then you're going to have your audiologist or your deaf educator, functional listening evaluation, those type of things. I think the bigger idea from this about who is responsible is that team approach, that regardless of which box you've checked on there for assessment, that everyone will be involved in that. And that's information gathered from every person working with the child. As far as their background information, you want information from their teachers, their therapists, their parents, interpreters, audiologists, interveners. As far as administering the assessments, it should be at minimum a team effort between the teacher of the deaf and the speech and language pathologist at the very minimum. And that's because each profession views unique aspects. One of the things we thought was important was to put that we stay within the scope of practice. So if you're fortunate enough to have an audiologist in your county, if you have an educational audiologist and you're having your speech language pathologist and a deaf educator that are going to be working together, you would not expect the audiologist to do a language evaluation, just as you would not expect to do one of the audiological services from the deaf educator or the SLP. So staying within your scope of practice So it's more about not who does the assessments, but it's about the team analyzing those. So first of all, we look at who we are assessing. And so we're going to look at the students with the following exceptionalities. Are they deaf, hard of hearing, or deaf blind? Well, from an audiology perspective, if you are deaf and hard of hearing, those are based upon degree of hearing loss. But based upon policy 2419, to qualify a child for deaf or hard of hearing in West Virginia, it's actually based upon their mode of communication, how they are able to receive language. So they are considered deaf if they receive all of their input through American Sign Language, through a visual communication, through ASL, through Sign Exact English. They are considered hard of hearing if they are able to obtain the information auditorily, and then deaf blind. And then we look at why we are assessing, to identify the areas of remediation and to qualify for services. And then when we're going through this, if you think about, as Karen talks about different things with these assessments, all of the language that we're talking about, language used in the classroom and for academic tasks, is going to be English. Also remembering that American Sign Language is a separate language with its own structure, vocabulary, and grammar. So the team must clearly decide if they're assessing English, ASL, or both, and that the purpose of your assessment will influence the assessment tools the team selects. So depending on what it is you're assessing. So an example of that, if you want to see, if you're trying to evaluate the sign language skills of a student who uses sign language, that you're specifically looking at their sign language skills. So you're going to be using an evaluation like the, an ASL checklist, or the variety of language evaluations that you all will get a list of. Hopefully will be attached, I think, at the end, or will be emailed to you guys, of resources. Are you evaluating English language skills of students who use sign language? Are you looking at the English language skills of students who use listening and spoken language, or English language skills of students who use total communication? So you want to look at how you're going to give the assessment, but what specifically are you assessing? Because if you're looking at English skills in a child that uses ASL, you're not going to use an ASL checklist, because that's not giving you English. Those are giving you the sign language skills. So really thinking about what are you assessing before you go into the evaluations. Gail, do you want to chip in here on this? Gail, are you there?
I'm talking away, and apparently my mic got muted. Thanks. So the teamwork needs to begin at the beginning, when you're planning what kinds of assessments you're going to do, and so on and so forth. So as Nora said earlier, the minimum needs to be the SLP and the teacher of the deaf and hard of hearing. Ideally, you'd want to include an audiologist. You'd want to include input from the classroom teachers. As many individuals that are involved with that child's education, you really want to include. So the first decisions that need to be made are, what are the appropriate tests, what need to be, what kinds of things need to be evaluated, sort of a needs assessment, and who all needs to be involved. So do you need to bring in a school counselor for part of the assessment, or do you need to get a report from the audiologist in the next city over, whatever? One thing that's critical is that if the evaluation is being done in ASL, then the person administering that assessment must be fluent in American Sign Language. So if that's the child's primary mode of communication, that examiner needs to be fluent. And then we want to know if we're doing English assessments, is that appropriate for a child who is deaf and it is using ASL? Nor do we need to look at other kinds of assessments. Test environment often is kind of a funny thing. You might get stuck wherever there's an empty room, but there are certain things that need to be controlled as much as possible. Again, read reemphasize that the language assessment must be administered in the child's primary mode of communication. So let's say the child is deaf and is accessing education through ASL, then there has to be an interpreter, teacher of the deaf, someone there who can administer the information. Controlled environment is really important. So you need to control for sound. You hear this from audiologists all the time, and I can imagine that being in the schools, it's like rolling your eyes and saying, yeah, how do we do that? But as much as possible, get into a quiet area of the school. Reverberation is an issue because classrooms tend to be hard surfaced, so usually tile floors, hard walls on the walls, very little padding or absorption sound. So speech sounds are going to bounce off the walls, and other sounds that are coming from inside the building or outside the building are going to bounce around off those walls too. So as much as possible, try to control from those sounds. And ambient noise in the hall, things like the fan running. Of course, you can't really control that. Excuse me. You can't control the fan in the building, but just keep it in mind. And while you are doing the assessment, listen and see if there are things that that you need to do to take care of meeting the child's needs for that. Okay, next. One that you can control more accurately is visual distractions. So you want to make sure that the room where you're doing the assessment is not filled with lots of visual pictures, graphs, so on and so forth that are unrelated to the assessment. So you may need, if you're in a classroom that has lots of activity things on the walls, and you might need to hang a sheet over a wall or face the child away from some of those things. You want to make sure that there's proper lighting, and proper lighting means that the light is falling, if it's a spoken stimulus or a sign stimulus, the light needs to be on the front of the examiner, so not behind them. The examiner doesn't want to stand in front of a window with light coming around because that person will be in the shadows. So the light needs to be on the examiner, and also the information that the child needs to see needs to be lit up well. If you're not familiar with the child's hearing technologies, if they're using hearing aids with an FM system, or if they have cochlear implant, if they have a remote mic, if they have things that need to be, the boots need to be put on for such and such a thing, find out about those ahead of time. I highly recommend you have backup batteries, and you can ask parents to provide those. That's typically something that parents provide. They may get them from the audiologist, but it tends to be the parent's responsibility to get those into the classroom. Again, the technology might include a remote mic, which is kind of handy because then the mic is usually worn by the examiner with SLP, teacher, deaf, whatever, and transmits directly to the child's hearing aids or processor for cochlear implant. So if the child has it, use it and know how to use it. Okay.
Right. Gail, this is Nora. I'm going to jump in real quick. So many of the counties do not have audiologists working in their counties. That's right. Unfortunately, there are a lot of places. So this is, and if you are fortunate enough, but this is a good example of where you have to have that team collaboration. So making sure that if you have an audiologist, that they are helping to show the other people that are going to be doing evaluations, not to just assume that someone understands how to use that, even if it's just the microphone from the FM system. So working together to make sure that they have everything. So whether it's the deaf educator or the SLP, the audiologist, whoever is most familiar with that information, making sure that you've shared that information with everyone else as you do that. So this is a good example from the very beginning, needing that collaboration rather than just assuming that the next person is going to be using the equipment properly.
Exactly. And so if you're in a county that does not have an audiologist, find out who the child's audiologist is and contact them. See if you can meet with them. See if they have videos that will show you how to use it. It might mean a little bit of extra time that you have to put forth to make that connection, but really you do want all the technology working properly. And so if something's not working or you don't know how to use it, that's a hindrance to the evaluation. So yeah, make it a point to talk to an audiologist and get the information you need. One thing I'm going to talk about later on is listening fatigue. So ideally, you want to schedule the evaluation. I said early in the day, but early might not be the child's optimal time. Typically, afternoons are when kids really get fatigued, but sometime in the morning is ideal to do your evaluation because you want the child to be alert and not worn out. Okay, I think it says Karen. Karen, is this you or is it? This is me. Okay, sorry. So some of the things you need to consider for planning your comprehensive language evaluation. We're going to list a little checklist here and talk about other things. So first of all, you need to gather case history information. You want to know background information about this child. You want to interview the parents, teachers, therapists, again, anyone who is involved in working with this child. So you want to know what their experiences are with this child. So you probably have heard the example of a group of people who are taken into a museum and blindfolded and taken into to touch an elephant and try to describe it, but they're blindfolded. So some people say, oh, it's really tall. Some people say, oh, its skin's really tough. Oh, it feels like a tree, whatever. And they're all that elephant from their own perspective. So when we look at when we look at children from different perspectives, if we pull all the information together, we get a better picture of what the child's needs are and what we can do to intervene. So we want to review their sensory and their motor and cognitive status. Again, like I said, you might need to bring in the school psychologist for evaluations. One of the important things is that as the examiners need to observe the language skills of this child in various environments. So observe the child in the classroom. Observe the child at play. How does the child use language when they're one-on-one with the teacher versus in a classroom play? We'll talk a little later about formal and informal assessments, so you're going to do both of those. Following the assessment, we're going to identify effective intervention strategies. So we'll come up with a plan on what needs to be done that can assist the child in this area. And then the language evaluation is generally not a one-time thing. We're going to follow up excuse me, and follow up and monitor progress. So we're going to repeat this process periodically, typically annually, but it may not be that long between. So just so that we can see how the child is doing. Okay. So prior to beginning the assessment, things that you want to do to gather background information, or you want to review the child's records. Sorry, I'm getting coughs again. Since I've retired, I don't talk as much every day. So you want to review the academic records And you want to interview the individuals, like we said earlier, who are involved. You want to get details. So if you're not sure about information, make sure that you ask for clarification for that. Next, yeah. So critical factors to consider background information. From an audiologist perspective, we're going to say you need to know how the child accesses sound and hearing. So you want to know type, degree, and configuration. How severe is the child's hearing loss? Which phonemes or language sounds, speech sounds do they hear, or which do they not hear? How old was the child when the hearing loss began, and when was the hearing loss identified? Hopefully, in more recent years, we're getting kids identified very, very early and intervention begun. But we want to know when amplification was begun, or if we have a cochlear implant, when that was completed. Ideally, we want to know the etiology of the hearing loss. Is it likely to be progressive, and how is that going to impact evaluation? And in addition to amplification or cochlear implants, you want to know if there are other technologies the child's using. Next. Other things to consider from this gathering background information are what the child's communication skills are like. So you're going to hear us preach this over and over. What is the child's primary mode of communication? Are they using listening and spoken speech? Are they using ASL? Are they using signed exact English, cued speech? What is it that they're using, and know the difference among those? Okay,
Right.
so
And I'm going to jump in again, Gail, or yes, Gail. We've talked a lot about this. And one thing to remember, a couple of things when you're doing that, making sure that everyone that's evaluating understands the difference. Because a lot of times we will ask the question, or we'll have someone, when we go in, we'll say, well, are they a signer? Well, if you aren't familiar with a visual language, then oftentimes you may assume that they use American Sign Language, which is a language of its own. But several of our children may use Pidgin. They may be using cued speech, signed exact English, a variation of home signs. So if you're evaluating signing skills, a visual communication mode, you need to look and make sure you understand what mode of communication, what their skill set is prior to going in that. If you're looking at the grammatical structure and the order of ASL for a child who's never been exposed to ASL, then it's going to be very poor results. Whereas they may actually have language, but you make sure you're assessing the right thing, and make sure that you are aware of what each of those modes of communication. Also, we're not going to talk a lot about qualifying, but I think it's always important to remind everyone, regardless of whether you're the audiologist, the speech therapist, the deaf educator, mode of communication is always the parent's choice. It is not, as educators and as therapists and providers in the school system, it is not our choice. So even if we feel that a child may do better by using sign language, or a child may do better, have cochlear implants and have used sign at home, but you feel like they really need to work on their auditory skills, just always take caution. And remember, that's a conversation to have with the family and with the child, because the mode of communication is their choice. It is not our choice as educators and providers and the school system for that.
Yeah, definitely.
Okay. Go ahead, Gail. Sorry.
No, I appreciate you adding that. So again, you see repeated the child's primary language, and also consider if you need an interpreter for the assessment too. Okay, next. Some other critical factors to consider, again, for this gathering background information, is the vision status of the child. So do we have a child who is deaf-blind or has low vision? Are there other morbid conditions? Do we need to know things about the medical history that are going to inform situations that may arise during the evaluation? So does the child have diabetes? Is that something that needs to be factored in during the assessment period, so that we're not focused just on speech and language, but keep in mind there's a medical issue that may need to be looked at too. So know all of that information. Ideally, we want parent involvement. So you want to talk to parents and find out their perspective. Typically, we don't have parents involved in the actual assessment process, but as far as actual testing the day of the assessment, but we definitely want parents involved as much as possible. Other things to consider: is the child motivated? Will the child participate well? And you want to try to schedule or do what we need to do to try to get the child's motivation for this. Knowing the psychosocial status, the educational status, and cultural status of the child that we are evaluating is also an important issue.
So it's really important too to do observations. So in terms of this process, we talked about gathering background information, and that's going to be interviewing and also reviewing records. Then another component of this is really observing their language skills in a variety of environments. It's important to look at, as Gail mentioned earlier, with different partners, perhaps with the teacher versus their peers. Maybe look at it in a natural environment as well as in the classroom. And then whenever possible, to also look at the skills in the home environment. And that might be because of course it's often difficult to actually go and visit the home, it might be possible to have the family create some short videos that you can watch so you can get some sense of their communication skills at home as well. Next slide, please. So at this point now we begin to think as a team, what assessment tools? So you've gathered the information, you've observed them, you've done your interviews. So you have some sense at this point as team members about what is it that I need to look at in this assessment? And so you're usually going to evaluate those skills through some combination of formal and informal assessment. We also want to be careful about simply using global assessment tools. So a global assessment tool, one that comes to my mind is an SOP that I use all the time, is the Preschool Language Scale. And I expect many of you have also administered that test as well, but it only gives you a couple of items that look at each aspect of language. So you're only going to get just a very small snapshot of the child's vocabulary skills, of the child's grammar skills, or we think of it in SOP language as syntax and morphology. You aren't going to get any depth in those areas. And so while you may decide you want one of those assessment tools as part of your battery, it shouldn't be your entire battery. You need to look more in depth. As I say, at this point in the process, everyone should have an idea about the child's speech and language skills from the interview, from the observations, from the review of the records, to have some ideas about what areas of concern do we have, and to really look at those in more depth. And again, we keep talking about this chosen mode of communication. We need to make sure that the assessment tools that we're selecting are appropriate for the mode of communication. One of the things to keep in mind is, back to this idea of our global assessment tools, it is possible for a child to perform well on a global assessment tool, because as I say, they may have a specific area of deficit in one aspect of language. And the assessment tool, a global assessment tool, may only have a couple of items that look at that, but the other aspects of their language are good, and the assessment tool picks up on those. And so it might place them within a normal range. But it is certainly possible as a team to put that particular score aside and say, well, let's look in depth. We know that we have concerns about whatever area it is. And let's select an assessment tool that gives us an in-depth look at that area. Or let us create an informal assessment of that particular area so that we can identify what those issues are. So it is certainly possible for the team to decide that we want to, through this in-depth assessment, we've identified this area of weakness, and to qualify a child for services, even though a particular tool, one in several, indicated that they did not have deficits. So this is why it is important for us not to operate in towers, but rather for this whole assessment process to be collaborative, because everyone, as Gail mentioned earlier with her example about the elephant, everyone is looking at different aspects of a child's language skills. And it is certainly possible for one person to not see a particular area of need or weakness, and it's important for the team to really discuss that. Next slide, please. Gail?
Yeah, so for a child who's using auditory access to language, you want to do some sort of listening assessment, because looking at an audiogram will only give you part of the story. It will tell you what the child's ability to detect sound in ideal circumstances, but it doesn't necessarily give a picture of actual hearing behavior on a day-to-day basis. And particularly for our kids who are deaf and hard of hearing, the majority of them have sensory neural hearing loss, and that loss may be progressive. So from first grade to fourth grade, the child's hearing loss may worsen over time. And to my knowledge, we don't have a way to predict how that happens, how quickly or how much that happens. So that's a matter of monitoring, and your audiologist needs to do that. But I want to explain, to try to make it sink in clearly, that sensory neural loss is not just a loss of loudness. Stereo in your car and you turn the volume down. There's more to it than that. It's more like the addition of a factor that the wires in your speaker are faulty and they're not connected properly. So not only is the sound too soft, but it's not clear. And that results in the ear from hair cell failure. So the signal is not transmitted, the auditory signal is not transmitted clearly to the auditory cortex. So making things louder may not make things better. Making them louder doesn't make them clearer. And so SLPs probably know this pretty well. Teachers of the deaf obviously do, but classroom teachers need to be advised that talking louder and especially overemphasizing speech are poor ways of managing listening for a child with hearing loss. Okay, next slide. So development of auditory skills, they start in the womb, and listening behaviors or auditory skills actually develop over the first several years of life. And they begin in a hierarchy, and this hierarchy tends to be pretty set in stone, and things need to be things. Listening and auditory behaviors develop in this way. So first of all is detection, and these things happen incidentally in children with normal hearing. But with kids with hearing loss, we need to intervene and work them through these. So detection of sound is is important. Maybe some of you have seen the YouTube videos of a child whose cochlear implant is turned on for the first time, and mom or dad speaks, and the child suddenly turns and their eyes widen. Okay, well, the child needs to detect the presence of speech, and then they learn to discriminate, same or different. So is that sound the same as this sound, or is it different? So when we talk about gross sounds, is the car horn the same sound as the knock at the door or not? When it comes to speech and language, which speech sounds sound the same, which sounds different, so on and so forth. The next step in that hierarchy is identifying individual sounds. So, oh, that sound is a SH sound, or that sound is the E sound, so on. Finally, comprehension is the last stage of that development. So making sense of meaning of speech and language comes last. And the point is that unless the child has been taught the previous steps of the hierarchy, we can't expect them to achieve comprehension. So if they haven't learned detection is going to be based on typically their intervention, their hearing aids, their cochlear implant, so on and so forth. Discrimination needs to be taught, identification needs to be taught, and comprehension pulls that all together. So next slide, please. Thank you. So detection first, then discrimination. Degree of hearing loss plus their amplification or technologies impact the development, whether that development happens sooner or later. But the bottom line is, don't expect higher level auditory skills until the lower level skills have been achieved. So if you are working on, I don't know, I can't think of a good example, a pluralization. If you want to work on plurals for a language goal, but the child doesn't perceive the S sound, you're going to have a hard time teaching that. So make sure that they get all those other steps in development. And then the next slide, I talk about, briefly about APD. Kids with auditory processing disorders have similar listening behaviors as kids with hearing loss. But it's not appropriate to do an APD evaluation on a child who does have hearing loss until the hearing loss has been addressed. And most of the assessment tools for auditory processing disorders are not appropriate for kids with hearing loss. There are a couple of them. But if you suspect a child might have APD, make sure that they have a hearing evaluation first and rule out any hearing loss. Okay, next slide. All right, listening fatigue. For children with hearing loss, listening is very difficult, especially over extended periods of time. I put a picture of a woman in the bottom because listening to kids in the classroom all day can cause fatigue in adults as well as in kids. But when kids have to listen to distorted and unclear speech and try to concentrate on it over extended periods of time, they can become really, really tired and zone out, and you've lost their attention. I'm not saying that kids don't misbehave, but a lot of times these kids who have been working hard and listening all day are not misbehaving. They are just worn out. So I would encourage you to advise teachers that your kids with hearing loss need short breaks. And again, schedule assessments earlier in the day when they're at their peak.
All right, so now let's talk about what this speech and language assessment is going to consist of. What are we, what, how are we going to organize it? So first of all, we always know we need a battery of tests. We don't want to just give one assessment and be done. We need a battery of tests. And so our battery should include standardized tests as well as informal assessment that always includes a language sample. So let's talk about those standardized tests first. So one of the main issues with a low incidence population like children who are deaf or hard of hearing is the fact that there are not very many tests that are actually normed on that population. There are a few, but the vast majority of tests that we as speech language pathologists typically give are not normed on children who are deaf or hard of hearing. The Joint Committee on Infant Hearing in 2007 stated that standardized assessments normed on hearing children are considered best practices for evaluating the language skills of children who are deaf or hard of hearing. So it is certainly appropriate for us to give tests that are not normed on this population because they are, if we are evaluating English skills, so the language that is spoken in our classrooms, English skills, we can use those tests as one part of our battery to look at the child's English skills. But really, we are not comparing them to a group of peers. So if we are giving a normed test and we are calculating standard scores, we're comparing apples to oranges. We're not comparing a child to a group of their peers. So that standard score can't be interpreted as if we were comparing them to their peers. That standard score could be calculated and could be used to look at progress over time. So if I want to know how much progress a child has made from one year to the next, I could administer a normed test and calculate the standard score and look at the growth in that standard score from the previous assessment. But I'm not comparing them to their peers. And so it is important to keep that in mind when you're administering a normed test. And if you are reporting any standard scores in a report or in an IEP, you'll always want to note the fact that the test was not normed. If that's the case, the test was not normed on children who are deaf or hard of hearing, and any test scores must be interpreted with great caution because you are not comparing them to their normed peers. So we want to make sure that makes sense. Now, as we have researched the latest literature on assessments for children who are deaf and hard of hearing, there are multiple articles that support the idea that we would give tests for children who are, tests that are normed on children who are hearing, that we could give those tests to this population. But again, only to interpret with caution and always to identify areas of English that may need remediation. Nora, did you want to hop in here?
Yes, I was just going to say that maybe towards the end of the session, we may need to get Leanne and Mary Ann to jump in just to clarify, because I know when qualifying students for services, if we're looking at eligibility, that there are specific criteria that, especially for speech and language pets for speech services, that they have to have certain scores, and there's certain criteria for that. And when you're not using those standard scores, I know that there's been some confusion about how the child can qualify for speech services if it didn't fall within a specific category on a specific test. So maybe that's an area that we probably would rather that Leanne and Marianne could address later in the session, because you are going to use a variety of tests. And so that score, because it wasn't normed, will not specifically fit into your guidelines for qualification.
Leanne, do you want to jump in now?
Sure. Even though it has a standard score of 78 in policy, one thing to remember is we never, ever place a student just based on one test. And for those students, if you think about it, those students who are nonverbal and that kind of thing, we can't have a standard score of 78 for them typically. But we can have information that can help us make an informed decision. So, just worry about getting the information that's needed to make the student eligible. And then it's the eligibility committee who makes that determination. So, with the information that you have, that you can get, it's important to make the qualification that it doesn't, meet the standardization. But I wouldn't worry specifically about that standard score of 78 for language eligibility. Marianne, do you have anything to add or clarification?
Since Marianne didn't jump in there, we'll move on, but certainly any questions that you all have, we'll take care. We'll definitely have time at the end to try to address questions that you all have. Okay. So, and thank you, Leanne, for that qualification. So in that same vein, when Leanne was mentioning the standard scores, so we get standard scores from these norm reference tests, but we also have criterion reference tests. And so that's where we might have a tool that says, well, this particular skill develops in hearing children at 24 months or at 36 months, et cetera. And we have a number of assessment tools that are criterion referenced. And again, because that we are measuring a child who is deaf and hard of hearing against norms for hearing children, we have to qualify again that perhaps our tool was not designed for a child who was deaf or hard of hearing. But these assessment tools can certainly give us a window into some of the deficits that a child has in terms of their spoken English. So we may be able to identify that there are particular areas of weakness because they don't demonstrate skills that perhaps typically develop in hearing children at a younger age. So when we think about standardized tests, we're thinking about both categories, both the norm reference tests, the tests that are going to give us those standard scores in comparison with their peers, which we discussed. And then we're also thinking about criterion reference tests that are looking at how the skills would develop in that sequence that we know speech and language skills develop in their hearing peers. So we have a couple of different types of standardized tests that we might select from in order to identify any areas of weakness that may require remediation. Next slide, please, Nora. Another area that we need to consider is the fact that as speech language pathologists, I'm always thinking about receptive and expressive spoken language, but we need this team because we have to also look at sign language skills and written language skills. So when we have developed lists of tests, and we have tests that will look at receptive and expressive spoken language. We have tests that will look at written language. We have tests that look at ASL skills. So they're within the within the document that we will share with you at the end, you'll have tests that look at all of these different types of skills that you can select from. And it's important to not forget that we want to assess all of the different aspects that are important. So for example, we may have a child who comes into school who is using ASL as well as some spoken language. And so we may want to evaluate their ASL skills and their spoken language skills in the assessment. Or we may be dealing with an older child, maybe a third grade student or who needs to also be using written English skills, and we need to understand where their written English skills are as well as where their spoken English skills are. So there may be multiple aspects that we need to assess in order to have a clear understanding of where the areas of need are. So that's part of what the team will need to decide before they select the tests. They'll need to decide what areas they need to assess. In terms of assessing speech and language skills, as a speech language pathologist, I always think of these 5 categories. Nora reminds me that this is not the vocabulary that deaf educators or teachers of the deaf and hard of hearing think about. So I wanted to make sure that everybody understood what these 5 areas are. So phonology are the sounds of a language, the way that the individual produces, hears, understands the sounds of a language. Semantics are the vocabulary, the meanings of words or phrases or sentences. Morphology is the structures of words or parts of words. So we think about morphology as being plurals and past tense and present progressive, etc. So it is in a sense the grammar, as well as, and syntax also plays into grammar because that's the word order. We have, there are certain ways that we as English speakers combine words. And we know that children who are deaf or hard of hearing sometimes will have difficulty combining words, particularly if they've also used American Sign Language, because it has its own syntax, which is different than the syntax of spoken English. And then there's pragmatics, and that speaks to how we use language, the vocabulary, the stress and intonation, all of the different aspects of how we use our language are what feeds into the pragmatics, knowing what is appropriate, what kind of language you might use with a peer versus the language that you might use with a teacher or with family members. So being able to engage in a conversation that involves initiating a topic, maintaining the conversation through appropriate turn taking. All of these are aspects of what we think about as pragmatics in speech language pathology. Nora, anything you want to throw in here?
No, just again, that we all need to make sure that we are aware of that. So when you go into, oftentimes we have children who may not qualify for a certain service, maybe for speech and language services. And when we, as deaf educators, these are the questions that we can address. Or when we talk about evaluations, when we have these meetings to begin with all of our coworkers and the entire team, asking them, did the evaluations that you did you evaluate all of these areas? We look at all of these areas as deaf educators, and obviously we've all learned about this, but this is the common terminology that they use for SLPs. It is not necessarily common language that we use when talking about as educators, as deaf and hard of hearing students, as breaking it down. And I think it's very important that we all that we do look at that and look at the areas. And there are a lot of resources as we when you all get the appendix from our handout that has the list of everything. You know, there's some really great guides and some websites that have resources about this and how it applies to our deaf and hard of hearing students. We've used a lot of those for our references. So just making sure that you are aware, because for our children with a hearing loss, we know that they have these gaps. So they may be really good with one area, but then in the next area, they have huge holes. And this is how we find those, by looking at each individual. So, and Karen will talk more about doing the subtests and doing a variety of things. You guys, I think, will see on the next slide is the sample. Karen, you want to talk about this sample of our?
Sure. So there are, this is, as you can see at the bottom, this is just a snapshot of Appendix B. It's many pages. But what we have given you is the name of the test, the age range, so what age this assessment tool would be appropriate for, a description of the test, and then the areas that are assessed based on the definitions you just saw. And then also there are some other areas, some tests, as you can see, the cottage acquisition skills for listening, language, and speech, which is called the CASEL, which is different than the CASEL we talk about, comprehensive assessment of spoken language, that I talk about as a speech language pathologist. But that particular assessment tool looks at phonology, semantics, syntax, morphology, pragmatics, and listening. So we have listed, I don't remember how many tests, many tests. The appendix is divided by assessment tools for speech and language, assessment tool for children who are deaf and hard of hearing, assessment tools for ASL, so assessment tools that will give you insight into an individual's signing skills in ASL, and assessment tools designed for listening, and assessment tools that are designed for children who have been identified as being deaf and hard of hearing and visually impaired, so the deaf-blind population. So we have a wide variety of assessment tools, and the list is not really designed to be all-inclusive because, as you all know, tomorrow there will be a new assessment tool. As a matter of fact, Nora's been chasing down a new one for the last couple of months that we were having trouble finding because it hadn't been published yet, I believe. So this will be a living list that we anticipate going in and adding to, and then as tests become obsolete, removing those tests. We have tried to make sure that we included a lot of tests that you are likely to have access to, we also included tests that were available from the Salad Lab for at WVU, where you can request the assessment tools and they can be sent to you. So there are, and also I believe Mary Ann can help you if you are looking for a particular assessment tool, or Leanne, and you're having trouble finding it. I'm sure they would be happy to assist you in locating that assessment tool. So you're going to find a number of tests that are going to be available to you. And so this is really the list that the team would look at to select what tests you're going to give. So this is different than you may be operating now for a lot of your caseload. In a lot of cases, your whatever discipline you're in, you may find that you are making a lot of these decisions on an individual basis. We're suggesting that for this particular population, any particular discipline is not enough. In other words, we must all get together, look at the information that we've gathered to this point, and then look at all of these tests and decide on a battery that is going to really fit the needs for this particular assessment. So that is going to be available to you when we're done with our presentation. You'll have that list so that you can use it. There's another area that we wanted you to think about. So for formal testing, you can certainly look at that list. You can look for norm tests, you can look for criterion reference tests, and you can look against all the various aspects of speech and language, listening, etc., that you want to assess. We hope we have included all of those in that test list. But there's also another option. So in addition, not in place of, but in addition to those standardized assessments, a team may have identified particular areas of concern, and it can be anything. It could be the use of a particular grammatical structure, or as we think about it as morphology. So it could be that there is an issue of concern with the child's ability to code progressives or plurals or possessives, or it may be an issue with syntax or word order. It may be an issue with pragmatics or the ability to initiate and continue a conversation. It might be an area where folks have a concern that there's a limited vocabulary, or it might be that that there are simply issues with any aspect of speech and language skills. The team should have some ideas. We have concerns about this. We've maybe looked at it on a formal assessment tool, but we want to do some more in-depth assessment. So here you have the option of, through your informal assessment, to actually design a task that will assess that area. So you've identified this area of concern. Our example here on the slides was plurals. So you would create 10 to 20 items that will allow you the opportunity to evaluate the child's ability to use plurals. But because it is part of your assessment, you actually need to have this written up, and you need to write down each of the items that you've assessed and how you've done that. And that needs to become part of the record that will follow this child. So that task can be repeated in the future to look at whether or not the child has gained competency with that particular skill. So to help you monitor progress for that particular skill. So the team would identify, these are the areas that we have concerns about. Your standardized assessment hopefully we'll have looked at those areas, but again, we know that even if I'm doing an in-depth assessment of the child's grammar or morphology use, I may only have a couple of items that look at a particular morpheme, a particular grammatical structure. So I may want to design this additional task that will give me an idea of more in depth of where the errors lie. And then it will also help me document that that is an area of weakness. And then I'm going to write up that task, write down the exact items that I've administered and how I've administered it, and make that as part of the record. So the actual materials you may make part of the record. So you've created some test items that look at plurals, and you may have the pictures that you've used for that and make that as part of the record, or it may just simply be written up what the materials were. So this would be one type of individually designed task. Next slide, Nora. So another informal assessment is the language sample. And we really believe as a team that it is critical that a language sample be obtained as part of the assessment. So each evaluation should have a language sample. The language sample needs to be obtained in a couple of different environments because we may see that the child uses language differently with their peers versus with teachers, etc. So we want to look at language use in various environments and with a variety of communication partners. If the child's using spoken language, we would do it verbally. If the child's using ASL, we may be doing the assessment in ASL, or we may actually need a language sample in both ASL and in spoken language so that we can look, because as we said, ASL has its own unique grammar. And spoken language has its own unique grammar. So we would need to analyze those separately. Next slide, please. All right, so once you obtain your language sample, you're going to analyze it. And again, as an SLP, I think about it across these areas of phonology, semantics, morphology, syntax, pragmatics. So we want to make sure that all aspects of language have been analyzed in that sample. And we can do this for ASL, except for phonology, of course, but we can look at the vocabulary that's used. We can look at the morphology. In other words, how is past tense coded in ASL? How are plurals coded in ASL? What is the word order? And then also look at the pragmatics, or the rules that sort of govern interactions within ASL. So we can look at those 4 categories in ASL as well. Next slide. All right, so there are a variety of ways to analyze it, and all of these are also included in the test list, so you'll have access to the information about it. We often think about using SALT, that's as SLP's systematic analysis of language transcripts, which is also available to you through the Salad Lab at WVU. So you can send a sample and it can be analyzed for you. Or there are 2 other assessment tools that can be used. The Cottage Acquisition Scales for Listening, Language, and Speech can be used to look at various language structures, beginning where speech begins and then progressing to complex language. And then there's the teacher assessment of spoken language, so that it's a tool that is created, whoops, I see a little typo in there, to evaluate and document the development of sentence structure in children with hearing loss. So there are several different tools that are available to you to evaluate a language sample. Now on the next slide, there's actually a procedure that was written up in 2018, and this article is part of your resources that are at the end of our presentation. And so this was a process and analysis that was recommended for children who are using spoken language who are deaf and hard of hearing. So they're really recommending that, and I'm sorry, not just spoken language, but spoken language and American Sign Language. So they are recommending that you obtain 2 samples, 250 utterances samples. They're recommending that one be in a therapy setting and one be in a noisy and less structured environment. And next slide, please. And that they be analyzed using a checklist or a tool, and they're recommending, they're dividing language down into form, content, and use, which we in speech language pathologists think of as well. Form being the intelligibility, so that sort of falls back to that phonology we talked about before. The production of high-frequency grammatical morphemes, such as third-person singular, plural, possessive, which falls within morphology, and the ability to produce complex sentences, which falls into syntax. content. So the number of total words, the number of different words, that gives you some insight into semantics or vocabulary. And then use of language, the number and type of communication intents, repairs, and that falls within pragmatics. So this is just another categorization system to look at language by form, content, and use. And the same analysis techniques that we talked about earlier could certainly be used. But I just wanted to share with you information from an article that actually looked at language sampling for children who were deaf and hard of hearing. Next slide, please. Nora.
Okay, so we've gone over a lot of information about the assessments, and once our document is released and we can get that out to each of you, it has a lot of examples, more specific things, and hopefully we will be doing another follow-up session, a part 2 to this in the fall, where we can go a little more in depth. But for right now, our biggest takeaway from this is once you've decided who's going to do the assessments, how you're going to do them, you've completed the evaluations or the assessments, and now what do you do? So I think the biggest thing here is that the assessment results must be analyzed by the team, not just the person who administered the test. We each bring something to the table. We all have a different perspective. So if you're looking at the results and you are looking just the raw scores, or specifically you want to sit down and look at not only the questions, but the specific answers, exactly how did the student respond to that? How is that interpreted by the SLP versus the deaf educator versus the audiologist, or their teacher, different things, the people who all bring an expertise to the team. We've talked a lot about plurals today, but I'm going to use that one again. So if we looked at something and the child was missing an S off of the end of their words, the SLP may view that as an articulation error, which may be age appropriate. The deaf educator or the audiologist may look at that from the perspective that the child cannot hear a high frequency sound, so they cannot hear that S. So do they have an understanding of plurals if they cannot hear that? So you would look at that. So you're analyzing the test results to make sure that each of you come to the same conclusion or can collaborate on that. At no time, again, we all bring our own expertise to the table with these evaluations, and regardless of the student's age, or their ability in language, because there is different perspectives from it, it's important to collaborate. So at no time should there be one specific person deciding how to interpret those evaluations. So again, you want to look at the individual test items and the student responses. We talked about earlier, Karen talked about when analyzing the standardized tests that the scores can be used to measure progress rather than comparing them to the children of the same age. And we may get you in just a minute to speak again about that, Leanne, because several of the people had messaged that they weren't unable to hear you on that. So maybe you can talk about that in just a minute.
Sure.
So the standard scores cannot be considered valid since the tests were not normed for children who are deaf and hard of hearing. So again, you're using tests that are not normed for deaf and hard of hearing to assess the English language, English proficiency skills, but they are not the scores that would be used for determination of services, or that has to be a team decision. The team now should be able to look at this evaluation and determine the strengths and weaknesses, find out where those gaps are, and what do we do with them? How do we go from there? Where specifically do we do that? We've created just a few checklists. So when you're doing the assessment and you're looking at what you're going to do, these are the areas. Did you look at all of these areas? And one of the things that we have in our document, and maybe Leanne and Marianne can talk about that a little more, because it does kind of carry over into policy. Policy does state a comprehensive language evaluation be administered, and that you have to make sure they have adequate progress in receptive and expressive language. When we're looking at kids transitioning into preschool, we're looking at our early elementary kids where we're really building a strong foundation for language, whether it be in sign language, spoken language, written language, all of the areas. It's going to be very important. And a lot of people say, how often do we have to do this? Well, we know you have to do evaluations every 3 years for the reeval, but can you determine that there is only receptive and expressive language growth if you only evaluate every 3 years? Our children don't have time to wait 3 years to determine what we need to work on. So do you have to do this whole complete battery of everything every year? I think it depends on the situation. And again, that comes over to Leanne and Marianne question. But I think that you do have to look at where you are, because you can't assume that just because a student is in middle school or high school, they may be missing gaps that weren't picked up on those things earlier. So we wrote in our document that you do have to take into consideration what are the skills you're assessing. That's why from that very first thing, what are you looking for? What are the areas we need? And you're going to see a lot of that when you do the language sample. You're going to see what pieces are missing, and then you may need to do a further evaluation in that area. So you guys will be able to access these checklists just to have a basic starting point. And then when you're analyzing them, did you review all the test items and the student responses? Did you analyze the responses as a team? What were their strengths and weaknesses? And you will have enough information by doing these evaluations to be very specific. And so it's really a great tool once you actually do this one time for a student and you really delve into where those holes are. It's amazing the information that you can bring out by having that evaluation. My screen just, okay. Helps for developing goals and then also determining who will be responsible. You know, we oftentimes see our IEPs, and I had a question just the other day from a deaf educator that said, my county's concerned that the IEP goals are in the wrong place, or that this is an ELA goal, why are they under mine? Or those type of things. I think without getting too much into how you write your goals or where your policies are, I think having the idea for every child, but we're going to talk about our deaf and hard of hearing children, is that regardless of where on that IEP that goal is placed, that we're all working on the same things. You know, you may have a ELA goal that's not written over in your speech or in your under deaf education services under access, but you're definitely going to be working on those skills. You may have written a math goal in your access skills, or we're working on something with math because our students are very good visually and maybe do very well with numbers, but as soon as you add language in there and start with word problems, those type of things. So where are those holes? Are they struggling in math? If they're failing in math, then you look at how do we determine what that issue is, and it may come back to language. So these assessments will determine who will be responsible for the interventions and how you all will go about that. Again, we have a lot of different resources listed. Two things that I wanted to say just quickly is just a while back, I had a student that was transitioning, and during the initial evaluation for services, the child did not qualify for speech and language services. The language delays were age appropriate, and the articulation errors were appropriate. The evaluation that they used was just a basic evaluation that's usually used when, I think it was very common for when children come into preschool. And so when we started looking at the different things, when we, I started asking questions, you know, did you look at pragmatic language? Did you look at language processing and auditory skills? All of these different areas. And so the SLP, you know, we've got permission to reevaluate, to do further testing. And with that, I had shared with her, which is a great resource, and it's in the references. It's Steps to Assessment. It's by Karen Anderson and Lynn Price. And it is a book about assessing deaf and hard of hearing children. This particular SLP utilized that book. She reached out to some audiologists, auditory verbal therapists, fellow SLPs, deaf educators, and did an evaluation. And I think it took her 2 sessions to do the evaluation, and then came back to collaborate. But what came out of that was the child definitely qualified for services, but she said, you know, she would have never looked at all these different aspects of the child's language without going into several different assessments. So she didn't use everything, the whole assessment of one evaluation or the entire thing of another. It was bits and pieces of different ones. But it was allow her to see an entire picture of a child that she may not otherwise have seen. And from my perspective as a deaf educator, we often see that when there's just a specific evaluation that's completed. And I know there's a lot of questions for, how do we find time? How do we know how to do these evaluations? And so some of those questions, if you have questions about how we specifically do the evaluations or who is qualified to do specific evaluations, now is probably the time for you to ask those, because maybe we can answer some of those, but also now that we have Marianne and Leanne on here, so they will be able to answer those questions from the State Department level.
Is it okay if I go ahead and talk about the standard score and that kind of thing now?
Absolutely.
And can you guys hear me now?
Yes.
Okay, I think my mic was up on my head. I apologize. The first headset on, so I didn't think there was going to be I didn't realize there was a problem. If you think about policy 2419 and what it says we can use 1.5 standard deviations or a standard score of 78. And with that, if you make the qualification that they scored a standard score of whatever they scored, but then say, that test was not normed with deaf, hard of hearing students, I think you'll be able to use that score, and especially the information that you gathered from the test, to be able to make them eligible. The other thing is for preschoolers, if you look at policy 2419, it says that they can have either the 1.5 standard deviations or a score of 78, or informal tests that say that they require specialized instruction. So don't let the score, keep you or make you provide services for a student. Look at the entire picture. They've talked here a lot about all the components of a comprehensive language evaluation. And I know that we've just been talking the last couple of years about doing the language testing and that kind of thing too. So language sample analysis. And we have it set up so that can be done for free. You don't have to do it yourself. It can be done for free. All the directions are given within the Salad Lab website, and you receive the transcript back with the analysis, that's done by the WVU students. So please take advantage of that for these students and all of your language students. But just here again, remember that you do not base a student's service on one test or one score. It's in IDEA, and it's also in policy 2419 that we never do that. So hopefully that will clear up any confusion about being able to use a standard score and that kind of thing. And Marianne, did you have anything to add to that?
Can you hear me?
Yes.
Not so much with that. We did get a question about evaluating a student in ASL, and just want to direct everybody to the chat where I noted that for those of us who've had that situation, sorry, my chat's coming up. All right. That we need to evaluate a DHH student using their primary mode of communication. So even using a qualified interpreter with a high EIPA score, that interpreter will be missing information. So best practice is that the evaluator themselves be fluent in ASL, and to determine your fluency in ASL, there would be needed documentation to show that your ASL level, and there are numerous assessments that could assess that. So if you have that kind of question, or if you're looking for somebody to give that test, they can contact me directly, and we can give them some information regarding getting that.
There was another question too about high school students, middle school and high school students who maybe have passed language testing in the past and having to go ahead and do an evaluation on them. And the thing that I would say about that is, especially if they've developed a later developing hearing loss, we don't know if the hearing loss is going to be progressive, but we also, in the question, it stated that the student started experiencing academic difficulty. So many times in the past, I think there's been such a separation between the DHH teacher and the SLP that we need to realize that both disciplines have a role in serving these students. So, SLPs know that academic language difficulties can develop later on. So those developmental tests you maybe gave in kindergarten didn't pick up on those academic language difficulties, but later on there may be some language difficulties that were not picked up by those tests. So it's important for us to consider all of that. I understand that giving a comprehensive language evaluation takes time, but just remember this is a low incidence population, and the SLP's role in providing support for these students is critical. And that's what we're trying to get you guys to understand. It's a team effort. It's not just, oh, that's the DHH teacher's responsibility or the SLP does that piece. We all work together for the benefit of the student. And it's the same thing for those preschoolers that are coming out from birth to 3 transition. I've heard some discussions that, sometimes there's a misinterpretation, not a misinterpretation, but a misunderstanding about what you look for those students who are transitioning. And just remember that we look at social language, social communicative language for those preschoolers. We don't look at academic language at that point. So, providing as much early intervention and support for these students as soon as possible is critical. There are also a couple of questions about trying to do the report formats, if we would create report formats for you guys. So we will look into that and try to supply that for you as well. And Marianne and I are now proofing the document. We'll get it approved, and as soon as we get this document approved and designed in graphics, we will email you a copy since you've received this training. Are there any other questions? Yep, I see some coming in now. So all students who are qualified under hard of hearing, regardless of whether they have any speech language services or concerns, must have this comprehensive language evaluation completed. And I know that's a question I get all the time, especially when it comes up that the student's up for a triennial or that kind of thing. The way it's listed in policy right now, yes. And chances are, there are going to be some students that you're going to come out with, age appropriate results. But the way it's stated in policy right now, yes, that is something you have to do. But if you come out with the age appropriate results, just remember, then that means that there's nothing that the IEP team has to consider as far as language is concerned to try to get to get that student up to where they should be in expressive and receptive language. And the reason that was put into policy is because there are students who are deaf, hard of hearing, who have fallen through the cracks and who have had receptive and expressive language difficulties, and they haven't been addressed. And so since they're not addressed early on, then the student falls farther and farther behind. And as you guys know, language affects every subject. It affects their whole entire life. So we're just trying to be cautious in doing that. But, as we update policy 2419, we'll try to put some qualifiers on that too. But like I said too, remember, academic language difficulties can come up later on that you didn't find when you did developmental testing early on.
Especially for our population.
Yes, I think that's the biggest critical thing to remember here. These are not typical students. These students have access issues to language because of their hearing impairment, hearing loss. So, we have to consider them a little differently, and we have to support them as much as possible. And, we need to do it as a team. It's not just one person's responsibility or the other. And, while there hasn't been joint training in the past, perhaps there will be joint training, from here on out. So, and just remember too, like I said, those academic language difficulties can come out later on, 5th grade, middle school. So just to make sure you're supporting the student right now, yes, you need to do that. Any other questions?
So there was the question about, do they have to have this done triennial through their entire school career? If they're using data in other areas, do they still redo language evaluations? And you guys can answer that. But if you go back to what 2419 says, You have to be able to show, is the child demonstrating progress in expressive and receptive language skills through measured through an appropriate assessment tool. So if you're not doing evaluations and you're not looking at every one of those areas, how will you know if they are meeting those milestones? So
Well
anyways, you guys can address that about how often to have to do that. So does it need to be done every year or just at their triannual, once ever in their school career? How often does that need to happen?
Marianne, you want to go first?
Yeah. First of all, that was very well said, Nora. You know, I think it really was just stated there in policy, and absolutely, it does need to be evaluated at every triennial. The only reason that you possibly wouldn't do that would be if the child has a permanent hearing loss and there are no changes that would be made with that. And that's the same thing with how we ask for an updated audiogram. You know, the only reason you would not need to update it annually would be because the child does not have a progressive loss, that they have a permanent loss.
If they have even if they have a permanent hearing loss, the goal of doing the comprehensive language evaluation is to track their child's success towards English literacy. So would you still not have to do that even if they are profoundly deaf?
Oh, you would still need to do, yeah, you would most likely still need to do a language evaluation every triennial. But there are some instances where, you know, specific to that child, where if that child had a permanent loss, that you might not need to do that. So.
Well, I think too, one thing to remember is for these students who do, and you know, some of the questions we're getting from SLPs, I know are for students who have mild hearing losses. You know, they may be in all gen ed classes, but they wear hearing aids, and I understand, you know, the question there. But with these students who have severe hearing losses, who are using sign language, or who you know who are accessing their you know, their academics and their language through another means, like a visual means, you know, I think it's important for us to do those evaluations and keep track every year. Because if we wait for 3 years, then they can be so far behind we can't get them back to where they need to be. So, you know, you could just do it through a a additional evaluation form. And just remember too, you know, if you think about your caseload, except I know some of you are on here who have your entire caseload has these students on it because you're at centers perhaps. But, you know, for most of you, you're going to have one, maybe two students who on your caseload who are in this eligibility criteria, eligibility area. And, you know, for those students, it's critical that we support them. And not let the time pass before we do it. And, you know, honestly, just doing a screening for these students is not as helpful as doing the comprehensive language evaluation. So, and just remember, it's not just all on the SLP to do it, it's on the team to do it.
And this may be a question that Gail, you may want to jump in. But we were talking about a lot of people assuming that because they have a mild hearing loss, you know, if you look at the statistics, you know, a mild hearing loss greatly affects our children, even just a mild hearing loss. Absolutely. For their access, for incidental language, the things they're missing. And that's why this evaluation is so important, because on the surface, our children look like everything is fine. And everyone says, oh, well, they just have a mild loss. They're doing fine academically. But if you do an evaluation and you look at all these areas of language, you are likely to find some gaps, because once you're out of that 3-foot speech bubble, or once you are out of their, they live in a hearing normal world. So they have to be able to get that incidental language, and you're going to find a lot of holes. It's not for every child, but any child with a hearing loss, regardless of the degree of hearing loss, it's important. So just take caution about assuming that they just have a mild hearing loss. And another thing is that this is a great time. You know, it's a crazy time of year, but everyone's about to wrap up. The students are going to be finishing up the year. So these last days when the teachers are there and the therapists, or in the fall when everyone comes back and you have those days, it's a great opportunity for the deaf ed teachers, the SLPs, the audiologists. Maybe you guys can schedule a time to sit down and have a conversation about where you're going to go forward. because right now a large portion of our state is being served through teletherapy for speech. How are you going to do evaluations in collaboration? And this may actually be a good thing that you work as a team, because you can have the deaf educator maybe with the child, whereas the SLP that's on the other end of a computer to be able to assist with those things. So really to work as a team, but reaching out, finding out who the SLP is for your deaf ed teachers, finding out who is the SLP that's working with your child that's doing teletherapy, because sometimes you don't see them. You're not going to likely run into them in the building, those type of things when we're itinerant. That may be an option. And we have a question on here about access deaf students with very low cognitive skills. We have included some assessments in our document, like the communication matrix, several other things, deaf blind, or deaf hard of hearing with multiple disabilities. There are several evaluations how to assess language skills. So those are things that we will be sharing with you. You guys will get an email with those in them very shortly.
Karen, would you like to expand on that any, as far as assessing those students who have low cognitive skills?
Sure. I think it's always important first to determine for our deaf and hard of hearing children if it was just an access to language issue. So it's always important to determine whether or not they have had access to language, and if they have had access to language and continue to show a real depressed profile, then we might consider that they have cognitive issues. But we always have to remember that not having access to language can also create a profile that looks like the child has cognitive deficits. So that's the first thing
Absolutely.
I want to be very careful about, because we don't want to determine that a child has low cognitive ability based purely on for a child who perhaps has not had adequate amplification or was amplified later in life. We have got to take into consideration whether or not that child has had access to language. So that's part of the reason, Gail, you talked a lot about gathering that background information.
Right.
So it's going to be really, go ahead, Gail.
Oh, I was just going to say it's more common in, or was more common, quote, back in the day, but I had a client who was roughly my age who spent the first several years of his life in a residential facility for cognitively impaired until when he was early teenager, they found out that he just had hearing loss. And so that was common years ago. We don't want that to stay common now. So yeah, early identification of hearing loss and access to language is really important.
Yes. And so that's why we can't overemphasize that, that gathering that background information, really getting insight into when they were, when they received amplification, what kind of early intervention services were received, et cetera, all of the kind of things that will give us a window into understanding what their access to language has been. But as Nora said, we do have tools that cover the gamut on our test list. So if you're looking at early language skills, there are certainly tests that will give you information about early language skills, as well as looking at the complex language skills. So we made sure that we covered the full range of development in terms of tests that are available to you.
Karen, let me add in there, when there are concerns about cognitive issues and hearing loss has been identified, the cognitive evaluation needs to take place after some sort of intervention has been made regarding the hearing, whether it's hearing aids. Well, if it's an early identification, hearing aids are going to be done before cochlear implants are considered anyway, but we don't want kids with hearing loss entering into psychoeducational or cognitive evaluations without that access to language.
Yes, we can't overemphasize that access to language, or lack of access to language can present itself as if the child has a cognitive deficit.
Right, exactly.
And it is critical to weed out what the real issue is here.
I think those are all great points, and that's the reason I wanted you guys to address them. You know, one of the things I think we can see from all this is there are other people who need to hear this message as well, like the preschool coordinators and the people who help with transition. So I think that's important too, to have them involved with this discussion. So, you know, Nora had mentioned that we were talking about just having this be like an overview of the document and that kind of thing. And then the next training, we would try to get deaf, hard of hearing teachers, SLPs, and possibly like preschool coordinators to be with us as we you know go through the document briefly again, but then talk about the collaboration piece and then those important evaluation pieces that Karen and Gail were just talking about. So you know, there are all kinds of things to consider in this, but the biggest consideration we need to make is what does the student need from us? Does the student need us to help support them to access their academic environment? And I think we cannot just base that decision on test scores. So that's the reason for doing this comprehensive evaluation and comprehensive assessment and gathering as much information as possible. Now, Marianne, I see that you answered Paula's question. Do you want to go ahead and talk about that briefly?
Yeah, Paula was referencing the audiologist and saying that they had had an instance where they had gone to an audiologist and the audiologist did not feel comfortable answering some questions. And so they referred her to see an educational audiologist. Unfortunately, in West Virginia, we have a limited amount of educational audiologists, but fortunately, those audiologists that we do have are always welcoming you know, questions, concerns, and wanting to help. So
Yeah.
we have a list of those. We have some options coming up in the future. We've got a brand new service coming from Mrs. Rhea Dyer, hopefully in the future, that will offer that service as well. So we have some options for you. And if you are in that specific situation, we apologize, but give us a call and we will make sure we give you the resources you need so that you have an educational audiologist to refer to.
Okay, and
I was just going to say, as frustrating as it may be for that SLP, I'm glad that the audiologist who was not comfortable answering that didn't take a stab at it and have faulty information. You know?
Yes, that's a good point. I think too, Julia brought up the fact that we need to invite special ed directors too, and we can definitely do that or do a short webinar for them specifically about some of these eligibility issues and that kind of thing. And speaking of special ed directors, there is money from the 2 stimulus packages that has been specified for special ed. So special ed directors have funding right now to do things like purchase tests and that kind of thing, updated tests. So if you're in a situation where you might have to use some of these evaluation tools a lot, this might be a good time to approach your special ed director about purchasing some for you to have. We'll also check about seeing if we can have some at either the Salad Lab or the Technical Assistance Center for Accessibility in Romney that you could check out, because I realize that for some people, you may just use this test once a year and you need to spend your funding on tests that you use more often. But just know that you know, this might be a good time, like that Karen Anderson book that Nora mentioned. You know, if you're working with this population a lot, you might see if you can, you know, get that purchased by your special ed director as well.
Hey, Leanne,
yes,
can I reference the fact that I also want to make known that not all DHH teachers are as knowledgeable. They don't have the same credentials as an audiologist, but anybody working on that team, please utilize your team's strengths. And if you have a deaf and hard of hearing teacher who has that knowledge, then it may be something that will be helpful for the whole team. Just a lot of times, and I know not every deaf and hard of hearing teacher feels comfortable, but we do have a specific set of skills, and we deal with audiograms often. So if you have a strong DHH teacher, please use them as your support as well. Not in place of an audiologist, but just as reference.
And SLPs have audiology training as well
Of
to
course,
interpret
but I can't speak to
audiograms and that kind of thing. So it's a nice support for each other, you know, for both team members, you know, for all the team members to work together to do it. So, um, okay, I went ahead and posted the link to do the survey to get your ASHA CEUs. The time that has to be done is by Thursday evening at midnight. If you don't register by then, you will not get the ASHA CEUs because the certificates will go out on Friday in your email. If any of you experience difficulty with the link, I will post it as well in the email that I send you with the link to the video of this recording and the PowerPoint and the appendices that they mentioned that has the resources in them. We can go ahead and send those out for you now. So if there aren't any other questions, I see Vicki Holstein said even specialists that evaluate D and HH students, they often do not understand this population. Yes, that's a great idea. We'll try to get as many people who need to hear the message as possible to hear it, and that will hopefully take place in the fall. But one of the big things that we want to do in that training in the fall too is work on that collaborative piece. You know, so if you work with a DHH teacher, if you're an SLP or vice versa, if you can arrange to be, you know, either in person. We haven't been told we can do any in-person trainings yet, but we can definitely do virtual. So if you could be, you know, together to watch the webinar even and talk about, you know, how you can work together to make things happen, I think that would be great. Any final comments from our presenters or Mary Ann? Nora?
I really
Okay.
would. It's Mary Ann, I'm sorry. I just would like to, for everybody, to thank everybody for giving up some time. I know you're extremely busy. And for really listening to the information presented and really taking the information back and working as a team. When this first started, Leanne Brammer and I were so excited, and then to find, you know, these individuals out of Karen Gale and Nora to work on this and watch their progress through this, it really just supported the fact that we knew that this is a collaborative effort. It is usually in the school systems, we're not seeing it done that way. And we just want to, you know, reiterate the importance of working together as a team and to reaching out if you need support, training, and help. Leanne and I are always available to answer questions and to provide any support we can from the Department of Education.
Absolutely. Nora, I see you're lit up. Did you have something to say?
No, I was just going to say thank you for everyone.
Okay, well, thank you guys. Thank you, Nora, Gail, and Karen for doing this for us. And we will definitely be talking to you guys about doing some of the formats for us as well. As Mary Ann said, thank you to all of you who came today and spent some time with us. And be sure and complete the survey for your CEUs. And that's also for your professional development certificate. So if you just need a certificate to say you attended this, please complete that survey as well. All right, well, I'm going to stop the recording now, and